we're here with Liliana Partida, clinical nutritionist at the Center for New Medicine, and she's going to answer some questions for us regarding the hCG protocol. First of all, Liliana, what is the hCG protocol and what can I expect?
Well, the hCG protocol is a weight loss program that is either a 3-week or a 6-week segment. It is a protocol that is really unique in terms of weight loss. What it does is it stimulates the hypothalamus to break down stored body fat and preserve lean muscle tissue. So in a normal caloric restriction diet, which is really what hCG is, since it is only 500 calories, a normal diet would burn muscle and water, preserving fat. But uniquely, hCG preserves the muscle and breaks down the body fat. So it's very exciting for us, for our patients, to see that they hang on to their muscle and they are able to burn that useless fat, usually around the abdominal area that is so hard to get to.
And what exactly is hCG? Is it safe?
hCG is very safe. It is a hormone that a pregnant woman produces. It is to basically tell the body to hold on to lean muscle tissue. Usually a woman, especially in the first trimester, may not eat very much during her pregnancy. And so it's the body's preservation for the fetus and herself to preserve the amino acids. So the hCG really, it stimulates the body to break down the fat and to preserve the muscle. We use injections that the patients would administer themselves. There's also a sublingual that we do as well. Now with the injections, we have a proprietary blend, which is what we like to use most, because we can really do a more precision in terms of if the patient is feeling a little tired. We can add different endocrine supporting nutrients as well as B12. So it's a little bit more, I would say, prescribed to their needs, where the sublingual is just basically dosage according to the protocol.
And what other supporting mechanisms are part of this program? What if I have other problems as I go along?
Well, one of the unique things about being medically supervised is that we do before labs, in which we will be testing your thyroid, your adrenal glands, a basic CBC panel, if you are a good candidate for hCG. So we will define whether you need thyroid supporting or adrenal support. So this really enhances weight loss as well as to support the energy, because imagine that your body is consuming only 500 calories and it has to break down fats for the remaining caloric intake that you would need metabolically. So the body can undergo a little bit of fatigue at times. So having the additional B nutrients are very supporting during the hCG protocol.
And what makes your protocol different in addition to the supporting nutrients?
Well, what makes our protocol different, I would say, really is the amount of support our patients get. They have a visit with me once a week, and so that we can go over anything that they might be feeling is a stumbling block, whether it's an emotional factor of feeling hungry or whether they truly are hungry, and that we need to adjust their protocol, whether it is to increase their protein a bit, whether they're to give them some more B vitamins, or to support their endocrine system. So we're really able to individualize this program to the patient for their success.
And what happens after I'm finished with the program?
Well, of course, you have to go on to a maintenance protocol, and we have a lifestyle course here, which is very unique. It's a 6-week program, and so during that 6-week, they're really going to have the education to anchor their success and for their continued success. And that class meets for 2 hours each week, so it's a lot of supporting, I would say, scientific reasons why one should stay on a lifestyle and not go back to the regular eating habits.
And what happens with your skin? I've heard if you lose a lot of weight rather quickly, it can sag, or am I going to get wrinkles?
This happens a lot when patients go on what we would consider a normal caloric restriction diet without hCG, because imagine the body is all about survival, and so since fat really is your reserve, it will begin to break down muscle before it begins to break down fat. And so what happens is that as the muscle becomes lower, so does the metabolism, but also to the tautness of your skin is suffers as well. But the unique thing about hCG, because it preserves the muscle, we find that actually your skin becomes taunter. A lot of patients, remarkably are saying that, they feel younger, they look younger, and so really we would attribute it to the anti-aging factors of the hCG.
That's great. And then aside from weight loss, what other unique successes have you seen?
Well, one of the exciting things that we are experiencing with our patients is the amazing medical results that they're getting. Type 2 diabetic person, clearly in an advanced state, from a 7.4 hemoglobin A1C, after 4 weeks of doing the hCG protocol, went down to about a 5.3, so definitely out of inflammation. Excuse me, we had one patient that went into the hCG protocol with a fatty liver, and it was remarkable to see after 4 weeks on the hCG, and only 4 weeks, that when we did the ultrasound, there was no signs of a fatty liver whatsoever. So that was really exciting news for us.
Wow. Well, thank you very much, Liliana. And for anyone out there that would like more information, please give us a call at Center for New Medicine at 949-680-1880. You can also find us on the web at www.cfnmedicine.com. Thanks again and have a great day, everyone.